I've heard even a guy say, you know what, like when I was 20 years old, I was dating some girl and she made some comment about some guy's dick that she had dated before me, right? And then
Hmm.
it's like that just for the next 20 years bothered the guy and he needed to have a bigger one. And it's not even that there was anything wrong, for I can't think of who exactly told me that, but probably the guy was above average in the first place, but it's irrelevant at that point, right? It's just like that's a thing that just got in his mind and it's not going to go away until he goes and gets a bigger dick.
Dr. Joel, welcome to the show.
Thanks for having me.
Absolutely. My first and most important question is, how are you doing? Like, actually, for real, how are you doing?
I'm doing good. It's the summer here. My wife's out of town. I got the house to myself. Everything's good. Nothing to complain about.
Yeah. I assume if you're like me, you probably work a lot. So what do you do in your free time when you have free time? No kid, no wife right now. What's a leisure activity that you enjoy?
Oh, I'm a guitar player, so I'll sometimes play some music around here. Been going to the shooting range a lot, so that's kind of a newer hobby of mine. Uh, do work around the house, gardening, that kind of stuff. Play tennis. I guess nothing exciting, but maybe
I
for
would I
some
would
people,
say
some of those things are exciting.
yeah, I would say going to the shooting range is exciting. Do you have a good shot? I'm from Texas, so we love our guns out here.
I have a pretty good shot. Like I could, with a handgun, I can get within an inch at like 10 yards probably. And I mean, I can hit something with a handgun at 25 yards probably.
Mm.
Um, I think that's good. I don't know. The couple people I shoot with probably can't do that, but I have no idea what real people like yourself can probably do.
Well, my wife had a better shot than me. My shot wasn't very good. I don't know, but I imagine since you're, a doctor and a surgeon, that you can focus pretty well on something really, really, really important. Because obviously you have to do that in surgery. You have to dial in on like the most specific part that you're working on. And I think that's the same thing when it comes to shooting or doing any sort of anything that's sort of singular focused.
Yeah, so I'm just to be clear, I'm not a surgeon. I'm an anesthesiologist, but we do procedures and all that with our hands. Obviously, what we're going to talk about also. So there's some truth to that. Funny enough, my wife is actually also a better shot than me. I think it's something with women that, at least I've heard this, that women can sometimes be better than men at shooting. It's like to your advantage to not be super strong, I think. Not that
Hmm.
I'm super strong, but it's like the more relaxed you are and the less kind of flinching you do, the better your shot's going to be. And I think having not like a ton of strength, that works to your advantage.
Makes sense. Makes sense. All right. So I guess to jump into the topic, um, my first question is, if you go to a dinner party and someone asks you what you do for a living, what do you say?
I you got to read your audience kind of, but I I do really like telling people that I'm a dick enlargement doctor. Obviously, there's two choices, right? I could just say I can do three things. I can just say I'm a doctor. I can say I'm an anesthesiologist, or I can say I'm a dick enlargement doctor or a penis enlargement doctor. And in the right audience, which is like most of the scenarios I'm in, it's I'll just tell them I do penis enlargement, and everyone thinks it's fascinating or at least interesting. If you can't have fun with it, you can't do it. You know, not this kind of thing.
Right. Is there a most common sort of follow-up question you get from that, or where does the conversation usually go?
It's like, really, you could do that? That's probably the most common. Second being that's hilarious or that's cool, that's interesting. Tell me more about it.
Interesting. When you first went to medical school, what did you think your life was going to be like?
Well, I thought it was not going to be anything like this. And so no one does, right? And this isn't something they taught us in medical school. So there'd be no, at any point during that 4 years of medical school and 5 years of residency, there's no possible way that you would know you were going to, this is how it was going to turn out. I trained as an anesthesiologist. So just, regular medical school. And I did a 5 year residency in anesthesia. And I did that for about 10 or 11 years before I got into this specialty. So I had a good run at normal medicine, and I still do regular anesthesia medicine about 2 days a week. So on a daily basis, I still kind of tell other doctors what I do, and they still
Mm,
think it's interesting.
yeah. Yeah, I find it very interesting. So then, what was the switch? How did you, start your own, co-found your own clinic and all those sorts of things? What was the sort of the genesis of all of that?
Well, I have when we moved to Sacramento, we started off in Tucson. We're originally from Canada. We moved to Tucson and then we ended up in Sacramento. And when I got here, I had a friend of mine from growing up who's from Canada, and he had been trying to introduce me to his brother, who's a surgeon in Sacramento. So it's basically like a childhood friend of mine whose brother happened to now live in the same place I did. And because of COVID and all those things, it took a while for me to get in touch with them and to meet up. But I did around in 2021 finally meet up with him, and he is a cosmetic surgeon. He's the part owner of Upsize, which is our business that we'll be talking about. So he's a cosmetic surgeon, and at the time he was trying to find some extra stuff to do in his office. He had like an office that was too big, and he had just met me, and so we were kind of brainstorming about what to do. And I did a little bit of research, and he did some research, and we just kind of came across this procedure, which was pretty new at the time. And I kind of had my wife look into it because I didn't want to necessarily look at all the pictures. And now I'm used to it, but at the time, I didn't want to look at that stuff. And she came back to me and she said, it looks real, it looks legit, like it works. And then that was it. Then we went and got training, and 3.5, 4 years later, here we are.
Wow. And how many people, male specifically, do you see each year?
Um, it'd be hard to give you an exact number, but I know I've done well over 1,000 procedures now. Um, Now some people get two procedures, for example, but a lot. Like we're seeing. I mean, I can't tell you exactly how many I see, but as a entire business, we had like 100 appointments last month.
Mm,
So it's quite a few. It's more than when I started.
yeah. So before we jump into specifically men and penis enlargement, things like that, I'll take a step back and maybe ask you about the larger sort of cosmetic injury industry itself. Why do you think that's so popular? Why maybe specifically as Americans we're so obsessed with maybe the way we look and all those sorts of things?
Um, I don't know why that is as Americans, but I do know that it seems to be that we are more in tune with that than other countries. Like we have two offices in Canada, and I can tell you at least from the inquiries we get, they're much different. Like people in the United States are more concerned with the way they look, and in my case, in the case of what I do, they're more concerned with the way their penis looks or how big it is, at least compared to Canada. Um, the general, like the aesthetics medicine business and cosmetic surgery and plastic surgery and those kind of things are growing in men. They've been, mostly a women's thing for the last 30, 40 years. And I think we're starting to see that it's becoming more um, normal or accepted in men to get some of these things done. And I think 30, 40 years ago, it was probably strange for women to get a lot of these things done. But everyone got used to that, and now it's kind of men's turn.
Mm. Do you think it's I don't want to say getting worse, maybe that's not the right word, but getting more popular or normalized because of social media and the filters and the way you can enhance your body? And then when you see that filter and sort of things like that, you want to make sure you can potentially look like that in real life. And then you also have people like Brian Johnson who are getting all these sorts of surgeries and think that he can't ever die. And do you think all that has an influence on the way people think and feel about, cosmetic surgeries and things of that nature?
Well, I'm sure it most certainly it does. For men, for better or worse, like for what I do, I would think pornography is a big aspect. You know, that's it's a lot more common for guys to be watching that stuff than it was 30, 40 years ago. And people kind of are watching that and think that what they're seeing is normal, whether or not it is, but then that's something that they feel like they need to improve or whatever. And so we see some patients that have done that. So and then as far as like social media goes, like obviously you're not seeing your penis or any penises on social media, but most certainly for things like lips and breasts and face and all that, yeah, social media is huge. And the fact that there are filters and you can make make your skin look 1,000 times better or make your face look better or whatever it is with the push of a button, that's super it becomes really a factor as to why people get these kind of things done.
Yeah. Yeah, just to share a quick personal story, I got plastic surgery on my ears when I was around 16 years old. My ears are pretty long, but they used to stick straight forward. And so obviously people called me, Dumbo and things of that nature. And I got bullied quite a bit for it. And it was pretty kind of ruthless growing up. But when I came home, like social media wasn't as popular back then. I graduated high school in 2010, so Facebook and some of that was still coming on. But when I got home, I was safe sort of from that stuff, and my parents were really loving and caring, and they're the best parents in the world. Nowadays, kids don't have that, and so. But anyways, my point being is that my mom said I found this thing online, is that you can get your ears pinned back, and I was like, no way, because I was thinking about getting braces. She was like, avoid the braces, get the surgery on your ears, and it totally changed my life, changed my outlook, changed my confidence, changed the way I viewed myself, changed the way other people view me. So I can understand internally why someone would want to get a cosmetic surgery, especially when it's something like that you get bullied or made fun of, even though most of the things we have on our body are unchangeable and like people probably shouldn't make fun of you about it, but they do because that's human nature. And so I can understand because it changed my life, why someone would want to engage in a cosmetic surgery. But again, like anything, there's going to be a vice of excess when it comes to that stuff. People get too many things and then go overboard. But yeah, no question there. Just anything you might want to say off that.
Yeah, I mean, that's a great story that you have, and it would be it's nice to hear that, right? That you could have something done and that it's that life altering. Probably most people that get cosmetic surgery, it's not like yours was kind of cosmetic, but kind of not in a way because it affected you more than maybe someone that just wanted bigger. Their breasts were fine, but just wanted bigger ones. But I mean, that's a great story, and we see that in my practice where it's not that people got bullied or that they were, there was anything specifically wrong, but they all of a sudden have a penis that's twice as big or 50% bigger, and their outlook on life changes, right? Like for whatever reason, they now feel more confident with that, or they feel if someone sees it, then that's going to give them more confidence, and a lot of times it does.
Yeah. So when a guy comes into your practice, into your clinic, what are they most talking about in terms of what they need? Is there sort of a psychological assessment that you go through about, why they might need this? Is this what they really want? What are you seeing in terms of that?
Yeah, I don't do a psychological assessment per se. Like most of the people that come in, it's pretty clear cut. Like 99.9% of people clearly don't have anything wrong with them per se, where they would need a psychological assessment. It's just the kind of thing where guys, they're doing it for various reasons, like either that they just want to have fun, right? They just think, I wonder, I've got some disposable income. I wonder what it'd be like to have a bigger penis. Maybe in certain cases they have a spouse that got some sort of procedure done and something they've been thinking about. So now it's a legitimate reason for them to, go through with this. There are some like minor confidence issues but they're usually not like something where, some person's life has not been to its full potential or anything like that. It's just like, yeah, I've always kind of thought I was smaller than other people or something like that. And so that we see people like that. And but by and large, it's just a normal group of people that could be me or you or your, dentist or lawyer or veterinarian or whatever, like just people in your daily life. And for whatever reason, they want to come in and get this done.
Yeah. It sort of makes me think about, because I'm an athlete, I've been an athlete my whole life. And when you're an athlete, you just grow up in locker rooms. And regardless of if you're trying to or not, you see everyone else's penis. This just is what it is. There's team
Right.
showers, like everyone's just hanging out, like just the shower head. There's like 8 shower heads. You get in there, like you're changing, you're doing all these sorts of things. And whether or not you want to, you look at the other dude's dick. That's just is what it is. Like, how am I doing compared to this guy? This is sort of the only shot I'm going to get to look at his wiener and compare it to my wiener. Like subconsciously, that's what's happening. Talk about sort of dick measuring contests, right? They can only really happen in in your own mind, right? But when you get in a locker room, you can actually sort of see. And because of this sort of nature and culture, I bet this has an influence on some of the guys that may be walking in and trying to get their penis enlarged because of maybe what they've seen or what they think they've seen, or maybe they feel inadequate about that. I mean, maybe that's not every dude that walks in. Like you said, some dude just want to have a bigger dick. Cool. It is what it is. But I feel some are having that sort of cultural stuff put on them. And again, you mentioned porn. That's probably a big factor as well. Being in locker rooms, that's probably a big factor as well. What they see on social media, that's probably a big factor as well.
Yeah. Or, I've heard th- it could be that. I've heard even a guy say, you know what, like when I was 20 years old, I was dating some girl and she made some comment about some guy's dick that she had dated before me. Right. And then
Hmm.
it's like that just for the next 20 years bothered the guy and he needed to have a bigger one. And it's not even that there was anything wrong, I can't think of who exactly told me that, but probably the guy was above average in the first place, but it's irrelevant at that point, right? It's just like that's a thing that just got in his mind and it's not going to go away until he goes and gets a bigger dick.
Yeah. Yeah. So how does the actual procedure work if someone, agrees to do it with you and they've decided to go forward with it? What does it actually look like? Does it take a day? Is there a long recovery time? Things of that nature.
It's a pretty straightforward procedure. The one we're doing is non-surgical, so it is a real medical procedure, but it's an injectable one. So the process, they come in, we're a doctor's office, so we see them, we do a medical history and physical and all that, and then we go over the expectations, what to expect, what the risks and the benefits are. So that all takes like 20 minutes, and then if the procedure is the right thing, it's about an hour, maybe 40 minutes to an hour to actually do the procedure. It's done using injections with a dermal filler. The dermal filler is kind of similar to what goes in lips or faces and with women. Typically, women get it, although men get filler put in their face for sure. So it's that kind of product. Takes about 40 minutes to an hour. People go home and they're just like back to work right away, to the gym the next day kind of thing. So it's very minimally invasive.
Someone coming on their lunch break to get their penis enlarged.
It's happened numerous times.
Oh, really?
Like, yeah, it's almost like you've watched like another interview I've done. Because my particular office is in San Francisco. It's near everyone's off. Like, San Francisco is not a big city. And so we have tons of people come in at their lunch break. I had a guy like it was like a couple of weeks ago. He was a firefighter, I think, and he was like on the phone with his whoever the boss is, like trying to tell guy that he had to go do some legal thing for his divorce or whatever. Meanwhile, he's in my office getting a dick enlarged, and then just goes right back to the fire department after. So
I think he
uh,
definitely is doing something for his divorce. He's trying to get back at it after his divorce. That's
exactly
definitely
right.
true.
But yeah, I'm definitely not a lawyer's office. It was just funny listening to like his excuse for why he's not at work. But to your point, you can totally come at your lunch break.
And then is there recovery time until you can potentially have sex again?
We ask people 7 days, so it's not
7 days.
horrible.
7 days until you can use your new dick.
Yeah, like a lot of people will come when their wife's going out of town, or you know they're going out of town maybe. But some people they just deal with it. It's not
Yeah.
for a lot of people. 7 days is not like life altering.
Yeah. Unless, yeah.
They might
Yeah.
not
Yeah.
have sex in that time anyways, right?
Right.
Especially
Right.
if you've been married for a long time.
And now when you're doing this penis enlargement, you're talking about the girth of the penis, not the length of the penis, right?
Yeah, it's typically girth. The the way I explain it is like if you want to add length onto your leg versus thickness onto your leg, to add thickness, you could get it stronger or you could get it fatter or whatever. You could put something under the skin, which is like what we're doing in the penis. You get it longer is a big deal, right? You'd have to like basically cut it, add something in, and then like stretch it out. And so basically for the penis, it's impossible to make it longer, but it's straightforward to make it thicker.
Hmm. Does this have
Does that
any
make sense?
impact on? Yeah. Yeah. Does this have any impact on the erection? Obviously, it's going to be wider, so that obviously makes it a little bit more. But is it anything harder or anything that like that going on there?
Yeah, it doesn't really have any direct effect on it in the sense that it doesn't make it better or worse technically, but as you pointed out, it's thicker, so both parties usually have more sensation at that point, and then it, indirectly can make it better. Just the more everyone can feel, the better everything is, right? More sensation.
Right. Do you have any any funny stories about anything that any procedures that you've done or anything like that that you could potentially share?
There's always like, there's so many funny things. I mean, what I'll say is that um, we, when people come to our office, everyone there is like, we like to have fun to the extent that we can while still being professional, obviously, right? We're a doctor's office, but it's a much different experience than what you're going to have in like a dentist office or your family doctor's office. Like usually it's me. So I have in my particular office, I have two staff. One of them's a guy that I also work with at the hospital that I kind of handpicked from any amount of people in the world. So he's got like a really good personality and, easy to get along with. And then I have office manager who is a friend of mine's spouse. So she's, again, really easy to get along with. I wouldn't have chosen her to work with me if she wasn't. And basically when people come there, it's just the four of us, right? There's no one else there. And we're making everyone feel at home, and we'll tell stories to each other and jokes and whatever it is, just to make everything nice and kind of relaxing. And I would say almost most people will tell you they had a good time when they were at our office. It wasn't like, it's not like going to the dentist and getting your teeth drilled or anything.
Yeah, going to the dentist is not fun. It's never been fun.
No, you would
Yeah.
think this wouldn't be fun, but it usually is. Everyone leaves and they're like, that was awesome. That was a lot easier than I thought. And you guys were cool. And there's maybe some music playing and having good conversations and stuff. So, yeah, it's a lot different than what people might think.
Are people sort of shy or reserved when they walk in for an initial meeting because maybe they feel kind of awkward or strange to go into a place that's potentially going to enlarge their penis? Maybe they feel embarrassed, or do you see any of that stuff?
Well, yeah, it's one of the things that we do from the beginning is like, okay, let's see what your current status is, right? Because we're going to talk about how the procedure you're going to get and maybe what your goals are. So you got to show me what you currently have. And that can be a little awkward for sure. It's just as awkward for me as it is for anyone on the other side of that transaction. But so I'd say there's maybe some of that, but I think afterwards, once we get started within doing the procedure within a few minutes, it just is what it is. And like I can usually get people to take their mind off that and in general, and then it's all good. I'm in particular, I'm pretty good at like talking to people and whatever it is your interest is, like I can go along with it. And I think, yeah, just get people's minds off of what you're doing, and then it's straightforward.
Yeah. Yeah. Is there any procedures out there that are very dangerous that you see being practiced quite often?
Well, I think most of the ones out there are dangerous. Ours is not, and the reason ours isn't, by the way, is because it's reversible. Modern dermal fillers made of hyaluronic acid are reversible with an enzyme. So in like most cases, if there was a complication, it would be very easy to just reverse the filler and it goes away. So, but most procedures out there are dangerous. There's basically a few ways that you can get a bigger penis. One is what we do. One is similar to what we do, where you put in a dermal filler, but the dermal filler is permanent. And so while the procedure itself is similar to what we do, it can be dangerous because if you have a complication, you would need surgery to reverse that. And then the other way to get a bigger penis is to put in implants, like silicone implants, for example. And those can be dangerous just because, anytime you cut open your penis, like you run the risk of all kinds of horrible things happening that most people would, if they knew about those things, would rather just get nothing done. Like, your whole penis can get infected. You can lose sensitivity. It can get smaller. You can get permanent erectile dysfunction, like all kinds of horrible things. And those are, in general, I always tell people don't have surgery unless you need surgery. And most people do not need surgery on their penis. So don't do it.
That's a good business model right there,
Yeah.
doctor.
Well, come to us and get injections, but do not get surgery.
Yeah, yeah. That's weird though. The silicone one, I don't understand. It's like the same thing you would put in breast implants you're putting in on a penis.
Something like that. It's it's always harder with the penis because the difference between, obviously a lot of differences between penis and breast, but the
Yeah.
the difference as it pertains to getting an implant put in is that the penis like vastly changes size all day, right? Like it could be, if it's freezing outside, 3 inches, and if it's a huge erection, it could be 6 inches. And so you got to figure, if you're putting an implant in there, like how do you choose what size to put in? When you're putting in
Mm,
breast implants, it's, I don't want to say it's an easy choice, but they can kind of like size everything out, and whatever they put in, it just stays that way. What happens here is, like, if you put one in that's too small, it doesn't do anything. And if you put one in that's too big, or that's bigger than your normal size, that's great, except for your penis will eventually shrink to smaller than that. And then there's like nowhere for the implant to go, and it'll like do things like poke through the skin, for example, or cause damage to the skin. So that's just a function of the penis like changing in size all the time, but you're putting in something that doesn't. So it's not an ideal thing to put an implant in, and I wouldn't get it done. I've seen all kinds of problems from it.
yeah. What about some of the at-home or sort of DIY stuff, like penis pumps or anything of that nature? Do you recommend those things? Are those effective? What's your take on that?
I don't recommend pumps. don't do anything long term. Like to the extent that they make anything bigger, it's like during the time you're using it and maybe for a few minutes or a few hours after. They do actually, we see that they cause like damage, sometimes permanent damage to the penis, not like something where it's not going to work anymore, but just like subtle things like changes in the skin or discoloration and all that. And so it's that, but with the upside being fairly minimal. So why do it? And then the things that kind of do work sometimes are stretchers. It is possible to stretch um, any. You can stretch anything in your body and get tissue remodeling over time. So kind of like the analogy there is if people put on weight, their skin stretches, right? And then it like remodels into just stretched out skin. And so you actually have more skin. So to the same extent as that, you could like stretch your penis over many months or years and eventually it would get longer. But we're talking about like, a half inch in length, not like putting 4 inches into 8 inches or something like that. And then there's the pills, which basically don't do anything and can be dangerous, just because we don't really know what's in them a lot of the times, or if we do know what's in them, it's something that's not effective or that's not regulated.
Interesting. Yeah, I can't wait to hear people listen to this episode and hear some success stories about the dudes who stretched their dick out over the next 2 years,
It
and it worked
does
for them.
it does work. There's actually a product that is I'll just give them a sponsor position here, I guess. There's a product called RestoreX, which is like a $500 device, and it is actually FDA approved for making your penis longer. The caveat there is the approvals for people that have like chronic disease. So
Mm,
certain things like if you have like bad diabetes, for example, your penis can get smaller. Um, so it's actually approved to stretch that out. Now you can kind of extrapolate that if you didn't have diabetes and a smaller penis, it might still actually work, and I think it probably does.
interesting.
Yeah, so we give that to some of our patients as just like a supplementary thing. Because again, it's
Mm,
not like doubling your size; it's just subtly makes it bigger.
yeah. What's the typical age of someone that is getting these types of procedures at your clinic?
Um, I would say kind of like, of course, I don't want to exclude anyone, but the average age, if I had to give one number, would be like 35 years old.
Mm.
Um, it could, we've had people that are 18 and we've had people that are 85. But just the one average would be 35 or 40, maybe 40.
Are they typically married or are they single men?
It could be anything. Like it's definitely not only single men. I could see where there would be this thought that, oh, it's probably only single men that want to have a bigger penis and get out there and impress people or whatever. But to the same extent that that might be the case, guys come in with their spouses, right? And they're like, hey, my wife just got a facelift. Like, now let's get a bigger penis. And they're there, like, trying to figure out how big it is together. So yeah, I mean, married people have lots of sex and 85-year-olds even have lots of sex. So we could see anyone in the office.
Yeah. Yeah. I mean, in some of the notes that were sent over to me about this episode, I read that it was this penile enhancement industry is a $7.5 billion industry. I mean, that's unbelievable.
Yeah, I mean that most certainly includes all kinds of pills and stuff on Amazon and all that. But yeah, it's big. I mean I would say the medical aspect of it is smaller but growing faster, no pun intended, and will overtake all the other stuff because it actually works. So of course things that work over time are going to become much more popular.
Yeah, I also found that very interesting because, I think a lot about young men in today's society and their having much less sex than they've ever had before. They're not asking women out. They're not going out. They're not drinking. And then you look at these older, mostly older males, 35, you said is the medium age, but you've had some younger guys as well. And this whole $7.5 billion industry of male enhancement, which means they want to have a bigger penis, which means potentially they want to have sex with someone. But then you look at a younger demographic, and there's a stat that says ages 18 to 24 males in the United States have never asked a woman out in person, 50% of them. And so it's like sort of the discrepancy between, you know, these sort of young men and maybe middle-aged men, or what's happening. It's just seems very interesting to me as I try to wrap my brain around this whole thing.
Yeah, that's like a whole other discussion, right? Is like it's a lot different to be a 20-year-old, 25-year-old today than it was when I was 20 years old, right? It's like vastly different. Like you weren't going to get in trouble back then from talking to a girl. You go up to a girl in a bar, you look like an idiot, right? But that's it. And now there's actually, there are repercussions sometimes for doing that. So I feel I have a little bit of empathy or I don't know if sympathy is the word or whatever, to younger people that don't have it as easy that way as we had it. But I mean, most people kind of figure it out, right? It's like, hopefully we're not going to have all the 18 to 24-year-olds like single for the rest of their lives. I think somehow it sorts itself out.
Yeah. I mean, as a young person, I totally would understand the trepidation as a male. If everything that I do is going to be filmed and recorded and potentially put on the internet for the rest of my life, there's no fucking way that I'm going to go talk to a girl. What if they film me being creepy or weird or stumbling or getting rejected or all those sorts of things that might happen? And most of them are going to happen. You're going to be creepy. You're going to get rejected, but you only get better through trying. But I'm not going to go and try a bunch of times if almost every time I'm going to get recorded by someone, or I'm at the gym and I go talk to a girl and she screenshots it, records it, puts it on the internet, calls me a freaking weirdo. Like, all of these things are real situations that have happened. So I get the trepidation as a young man. But still, I think they should go for it anyways. It's part of growing. It's part of learning. It's learning how to get rejected, learning how to talk to someone, learning how to say receive a no and still move forward. And like, you didn't die, nothing happened to you, you're okay. Learning how to respectfully communicate and understand cues and social things and all those sorts of things are wildly important for the rest of your life. Not just to, having sex, but like being a fulfilled human in the world.
Yeah, totally. And I think maybe like that's kind of what I was saying, that it probably eventually people figure it out. It's just maybe later and maybe harder at an earlier age now. But I gotta think that the guy that's like scared to talk to a girl when they're 18 because it might be filmed, like by the time he's 30 gets over it. And
I hope so.
And no, yeah, I mean, I don't know, but it's like that has to be the case. But yeah, I feel bad for guys that can't do, not, it's not that they can't, but it's just like you said, it's a different time, and all these things are harder than they used to be.
Yeah. Yeah. If some of the things that I did were filmed at university when I was playing baseball, I'm not sure. Yeah. But anyways, it is what it is.
No, totally. I mean, my friends and I, like, I'm 48 and we joke about that, not joke about it. Like, we talk about that all the time, because now a lot of us have kids that are 15, 18, 20, whatever. And it's like, I kind of feel bad for my friend's son, because they don't have, they can't have the same amount of fun as we used to have without repercussions, right? Even something simple like driving, right? It's like now you get your driver's license, so you can only have like one person in the car, and you can only drive before 10 p.m. or whatever it is, right? And it's like, when we got our driver's license, the first day you just pack like 30 of your friends in the trunk of the station wagon and it's all good, right? So just times are different now.
Yeah. Dude, I fucking remember the exact moment when my buddy Evan was the first guy in our friend group to get his driver's license and to get his car, and we went everywhere together. I'm pretty sure, like, if anyone had a date, we would all go on the date with him, because it was just like what we did. We were getting in the car, he was driving, he got on a date, and we would go with. It's like, I don't know, man, we just like having the time of our lives, trying to go out and have a little freedom, and that's what it was for. But then you learn, you fall down, you get back up, you learn how to do things, you learn how to have conversations. It's all part of the process. Have you heard of this thing, this hypothesis called the male sedation hypothesis? Have you heard of that?
Maybe just uh, tell me what it is, and then I'll tell you if I've heard it.
Sure. It's from this. It was coined by this guy named Chris Williamson, who also has a podcast called Modern Wisdom. And basically, when you get men, like in previous histories, when you get a lot of sexless men, there seems to be a lot more aggressive behavior in society. You know, like they're flipping off granny, they're burning buildings, all these sorts of things. But we're not seeing that nowadays with the number of men who aren't having sex because of this male sedation hypothesis, which basically means that everything in society is now geared towards sedating men, like porn, like online dating, like AI girlfriends. And so it's encouraging them that they can get a fulfilling life behind a screen and not go out into the real world and stumble and make mistakes and all these sorts of things and actually develop their true masculinity, their healthy, mature masculinity. They're being sedated behind a screen that they can get anything that they want in the world behind a screen, which is obviously not true. All good things happen in life because of relationships and all those sorts of things. That's the male sedation hypothesis.
So the hypothesis is that there's some sort of conspiracy where like they, the quote unquote, they want us to be behind the screen so we don't do crazy things.
So we don't, yeah, do all the bad shit that
Yeah.
men have done throughout
I
history.
haven't heard
So
that, but it's interesting. But I think like I don't know. Have you gone and tried the Apple Vision Pro at
I have
the
not.
so you should go try that. You can book an appointment at the Apple store and they'll give you like a 30-minute demo on it. Um, it's unbelievable. And to the theory there, it's kind of frightening because it is what you see when you put that on is so real that
Mhm.
I could totally see how there, and we're not necessarily far away from this point either, right? Because it exists today. So I could see a time pretty soon when guys are just like, yeah, you know what? I'm just gonna like put this thing on, and then you can mountain climb, you can go to a concert, you can do porn on it, probably, whatever, and it's indistinguishable from reality. Um, reason I'm saying you should try it is because it's hard to wrap your head around, but when you put it on, like it's something else.
Yeah, very interesting. And I think kind of frightening. Um,
Totally.
t-
Yeah, because like me or you or most older guys, like I've done the last 48 years without VR, so it's all good, right? But we're gonna. It's like 8-year-olds are playing video games now, right? I'm sure in the next few years, 8-year-olds are going to be putting on VR headsets, and when it becomes in like I said, currently is indistinguishable from reality once it's on. So it's frightening what could happen
yeah,
once the thing's not $3,500, right? Once it's $800, then that's
right.
kind of frightening.
Yeah, I mean, once upon a time ago, flat screen TVs were 3 grand, 10 grand. Now there, you can get a flat screen TV for $580, like
Right.
72 inches. So that's the same sort of process that might take. Yeah, I think about this a lot because my wife is pregnant right now, and we're gonna have a son potentially around the end of September if all goes smoothly, God willing, it does. And so I think about what my son's life is going to be like in 15, 10 years from now. Look, what sort of experiences are we going to have to go through together? What sort of new technology is he going to experience? Will he even need a driver's license 15 years from now, or will everything be a self-driving car? You know, maybe it won't be that rapid, but sort of you get my point. It's just on the basis of what we're talking about, like what sort of things are going to change. Will learning change? Will the way he goes to school change? Will he just have I don't know. It's going to be all, and we're all going to experience it all together, brand new, all at the same time. And it'll be interesting to see how he grows up with that and that technology and how he handles that and how we handle that as parents and all these sorts of wild things that are just blossoming in front of our face.
Yeah, I mean, most certainly all those things you said are going to be true. That's my guess anyways. I'm not an expert, but I mean, I don't know if you've driven a Tesla lately, but today it can drive itself. The only reason it doesn't is because there's a little camera that makes you pay attention, but it's like otherwise it does the whole thing. So your son being not born yet, I always say 100% certainty by the time he's 16, it can do it itself, right? I mean, it could do it itself today. So times are definitely changing fast for sure. And probably what's going to happen in 16 years will be something that we can't predict. And, but that's like, so it's something that we would never be able to predict, right? But we'll be
Yeah.
vastly different than now.
Hopefully, Arnold Schwarzenegger will be able to reprise his role as the Terminator and save us from all the robots. That would be cool.
Yeah, I just saw he's on a movie on Netflix, so he's back. So
We're good. We're
just like,
saved.
yeah, exactly.
Anyways, Dr. Joel, is there anything maybe that I didn't ask you or that you want to touch on before we wrap up this conversation?
No, I always say, guys that are thinking about doing this, um, it it's not a weird thing. It's not only for people with small penises. It's just the same kind of thing as you probably have friends that are girls that go and get their lips injected so they can have bigger lips, or they get their face injected, or maybe they've got breast implants or whatever. It's that kind of thing. It's like you don't have to be embarrassed about it. It's not weird. We're all normal. It's just if something you've been thinking about or want to improve something on you, give us a call or send us a message, and we'll talk to you and see what we can do.
Excellent. Yeah, all the links to get in contact with Dr. Joel are linked below. So if you want to reach out, go there. And man, I appreciate the conversation. It was very interesting. Thank you very much. And yeah, appreciate it. Thank you very much for tuning into that episode. And if you enjoyed it, click right here for another full-length episode of the podcast. And please don't forget to subscribe. But most importantly, above all else, please take good care of yourselves and others. And I'll see you next time. Lots of love. Cheers.